Amy, and I'm a stage 3 breast cancer survivor. This video is about surgical treatment options during breast cancer. We'll cover why surgery is important, what to expect, and how to prepare. Surgery is important because most cancer cells are invisible, so the surgeon needs to get in there to determine what is cancerous tissue and what is healthy tissue. It's kind of like crabgrass. From far away you might think the grass looks like healthy grass. However, you won't know until you take a closer look. Your surgery can be scheduled anywhere from 1 to 6 months after diagnosis, depending on whether your team prescribes preoperative treatments for your tumor. This is called neoadjuvant therapy and typically includes chemotherapy, radiation therapy, or endocrine therapy. On the day of your surgery, you'll check in at an outpatient surgery center or hospital. You'll be placed in a bed in the preoperative room. You may have blood drawn for testing. Your surgeon will meet with you and describe the surgery and what they think they will remove. And your anesthesiology team will ask you questions about your health. Once you're on the surgical table, your surgeon will mark where the tumor is located and additional tissue around the tumor. This is called the margin. They'll remove this tissue and a pathologist will immediately examine to determine if there are any cancerous cells within this margin. If the margins are not clear, then more surgery will be required until the margins are clear. I picture the tissue removed like a fried egg. The yellow yolk is the original cancerous tissue, and the egg white is the margin that will be examined for cancerous cells. After they receive pathology on your tumor tissue, your surgeon might perform a sentinel node biopsy. These nodes are the first few lymph nodes that track from your breast. These lymph nodes will be removed and examined immediately by a pathologist. After your surgeon receives pathology on the sentinel nodes, he or she will determine whether to remove some or all of your underarm lymph nodes on the side of your cancer. These are called axillary nodes. Lymph node removal is not painful. It will impact your recovery time, and you will need to minimize the risk of lymphedema after surgery. Depending on the extent of your surgery, you might have drains placed near your surgical incisions. The purpose of the drains is to prevent the accumulation of fluids around your incisions. They usually remain in place 2 to 3 weeks, and you'll be asked to clear and measure the drain output daily. When you emerge from surgery, you'll want to confirm the results from the pathology completed during the surgery and find out when the final pathology report will be available. The final surgical pathology report provides important details of your cancer. This report, along with scans and imaging, will guide your future decisions about breast cancer treatments. Your mobility after surgery will depend on the extent of your surgery, whether you have drains, and your general health. Your medical team will want you to start exercising soon after your surgery. Studies prove that patients have a more effective recovery if they get moving sooner. I had 3 drains for 2 weeks, but I still started exercises the day after surgery so that I could eventually regain the mobility I had before my double mastectomy. Surgery is an invasive procedure, so you should prepare ahead of time with diet and exercise, and by preparing supplies to take to the hospital. If you're having a lumpectomy, you'll probably be sent home the same day of your surgery. If you're having a mastectomy, you'll probably spend the night in the hospital even though you checked in as an outpatient. you and your caregiver will want to prepare ahead of time for a night in the hospital. The hospital will provide meals for the patient, but it can be difficult for caregivers to get food. Most of the cafeterias and snack bars close early, so I recommend bringing snacks and drinks for your caregiver. We also have a checklist for items that you'll want to bring with you on the day of the surgery. The link to the list will be available at the end of the video. Thank you for watching. Please take a moment to check out our other videos on breast cancer. And if you find this information useful, then please like and subscribe. This is Amy at Pink Streaks, reminding you that an informed patient is a good patient.